This is Eyewitness News. Now, Harold Green, Laura Diaz, Johnny Mountain, and Bill Weir with the Southland's #1 news.
Well, if you're putting the finishing touches on your holiday decorations, health specialist Denise Tador is here with a very timely warning.
But first tonight, a new procedure that allows some cataract patients to throw away their bifocal lenses forever.
Well, Harold and Laura, we got a twofer to tell you about tonight. Cataract surgery works wonders clearing up cloudy vision, but many elderly patients still need bifocal glasses to read or drive. But what if you could get rid of cataracts and correct your vision all at the same time? A new type of eye surgery may be just what you're looking for.
Okay, go down just a tiny bit more.
Dr. Bud Kurwa is about to perform an eye procedure that will take care of two vision problems all at once.
We are opening the cataract so that we can make it easy to remove it.
Cataracts made everything blurry for 78-year-old Wayne Coddington, and an inability to focus near or far made him a slave to bifocal glasses.
It was kind of blurry-like, and I couldn't see at a distance.
Today, that's all going to change. Dr. Kurwa will remove his cataracts and implant a new multifocal intraocular lens.
In most of the cases, we are able to get them to distance and near reading adequately enough that they don't have to depend on glasses for most of their activities, and most of them don't need it at all.
Using a specially designed tip, Dr. Kurwa does the entire procedure through a 3-millimeter opening. The small incision means shorter recovery and minimal complications.
We don't use any needles, we don't use any injections, we don't have to use any stitches.
The whole procedure only takes about 7 minutes, and right after, patients can see the results right away. Just seconds after surgery, we asked Wayne if he could see far.
Oh, I can see the name up there, name and allergy. I don't see my name up there, so I guess I don't have the allergy.
And if he could see small print up close.
Coddington Lane, ACT 919-1992.
Now that both your eyes are working well, what are you going to do?
Look at more girls.
He's going to put those eyes to good use. Patients wear an eye patch for about a week at night to protect the eye, and that's why it's recommended they get one eye done at a time. Bifocal cataract surgery runs about $2,500 per eye.
People all over the world are experiencing a new kind of freedom. It's the kind of freedom that allows them to make lifestyle choices that were not options to them before because they were totally dependent on glasses or contact lenses. Now, microsurgical procedures called refractive surgery are making a difference. Hundreds of millions of people all over the world, about 1 in 4, are nearsighted, farsighted, or have astigmatism, visual problems that can and often do hold them back, problems that put limits on their activities and enjoyment of life.
If I went skiing, the glasses clouded up all the time. Also playing golf, if it's hot or working out in the grove, perspiration drops down in your glasses. Very annoying, so I don't have that problem anymore.
Nearsightedness, astigmatism, and farsightedness are abnormalities of vision called refractive errors. People with these conditions usually have healthy eyes, but there is a problem with the way their eyes bend and focus light, so vision is blurry or distorted and needs correction. There are several causes of refractive errors. To better understand them, let's look at a simple picture of how the eye works. An image begins as rays of light reflected by an object. The light enters the eye through the clear dome-shaped cornea, passes through the pupil, and travels through the lens of the eye, and is then focused on the specialized nerve cells of the retina. These cells convert the light to electrical signals and send them to the brain, which interprets these signals as vision. Nearsightedness, or the inability to see things unless they are near, can occur when the cornea has too steep a curve. This can cause the light to focus in front of the retina instead of on it. Nearsightedness can also occur if the eye is too long in relation to the curvature of the cornea. If the cornea is shaped like the back of a teaspoon rather than round like a soup spoon, its curvature is steeper in one direction than it is in the other. That's known as astigmatism. This irregularity causes light to bend in such a way as to create more than one point of focus. Farsightedness can occur if the cornea is too flat or if the eye is too short. People who are farsighted can have difficulty seeing objects both at a distance and close up without corrective lenses. For centuries, the only way to correct these refractive errors was to place lenses in front of the eyes. They came to be known as spectacles and later as glasses. The greater the refractive error, the thicker and heavier the lenses. Contact lenses eventually made life considerably easier for many people, but contacts have their drawbacks as well.
I wear contact lenses, and on a plane the air is very dry, and I know that, and I daily wear contact lenses. So before I got on the plane, I had to have my contact lens case, my saline solution, my cleaner, my glasses, my prescription sunglasses, and I had to have all of them handy and available for me to take my contact lenses out, and had to put the glasses on to be able to see something. And I was very frustrated with that.
The first attempts to surgically alter vision by changing the shape of the cornea came about in the late 19th century. But it wasn't until the early 1970s that a Russian physician named Fyodorov proved that nearsightedness could be surgically controlled and corrected. The discovery triggered enormous interest and research, which led eventually to the procedures we now call refractive surgery. Today, with skill and knowledge gained from over 1 million refractive procedures, ophthalmologists around the world are successfully reducing or eliminating nearsightedness, farsightedness, and astigmatism. There are several types of refractive surgery being performed today: radial keratotomy, astigmatic keratotomy, lamellar keratoplasty, photorefractive keratectomy, and laser-assisted in situ keratomileusis are procedures that can treat a wide range of refractive errors. Radial keratotomy, or RK, has been successfully performed since the 1970s and is most successful in treating low to moderate amounts of nearsightedness. The amount of correction is controlled by the number and placement of tiny microscopic incisions placed in a radial pattern around the center of the eye, causing the cornea to flatten. This spoke-like pattern, incidentally, is what gives radial keratotomy its name. When light enters the flattened cornea, the point of focus shifts closer to the retina, and a clearer image is seen. When the refractive error is caused by astigmatism, your doctor may perform a modified form of RK called astigmatic keratotomy, or AK. The number and placement of these incisions are designed to change the irregular shape of the cornea from being rather spoon-like to more spherical. Lamellar keratoplasty, or LK, is another method of reshaping the corneal curvature. This procedure enables your refractive surgeon to treat higher levels of nearsightedness outside of the ideal range for radial keratotomy, and can also treat moderate amounts of farsightedness. The cornea is reshaped by an instrument called a microkeratome. A layer of the top segment of the cornea, or corneal cap, is lifted up as the microkeratome glides gently across the cornea. To treat high levels of nearsightedness, a precise amount of corneal tissue is then removed from the center of the cornea with a second pass of the microkeratome. The cap is then placed back into position without stitches. Removal of the center section of cornea causes the cornea to flatten, thereby allowing light rays to focus more directly on the retina. A variation of this procedure without removal of the center section of the cornea is used to treat farsightedness. Photorefractive keratectomy, or PRK, is another method of surgically altering the shape of the cornea for the treatment of nearsightedness, farsightedness, and astigmatism. However, instead of physically cutting the cornea, high-energy photons of light from an excimer laser split the molecular bonds in the corneal tissue and vaporize the central optical zone of the cornea with an accuracy of up to 0.25 microns with each pulse. The excimer laser is unique in that it emits a cold or non-thermal light beam. This makes it ideal for corneal surgery because it eliminates the possibility of thermal damage to surrounding tissue. The procedure itself takes only a few minutes. Once the laser begins, its sculpting is complete in a matter of seconds. Full vision recovery may take several weeks to months, but vision is often noticeably improved within several days. PRK has been approved by the FDA to treat low to moderate amounts of nearsightedness and astigmatism. One of the newest refractive surgical procedures combines the accuracy of the excimer laser with the lamellar keratoplasty technique. It's called LASIK, which stands for Laser-Assisted In Situ Keratomileusis, or Laser Intrastromal Keratomileusis. With LASIK, the cornea is opened in the same manner as in lamellar keratoplasty. Then, in less than 30 seconds, ultraviolet light and high-energy pulses from the excimer laser reshape the internal cornea. By adjusting the thickness of the incision and pattern of the laser beam, it may also be possible to treat farsightedness and astigmatism. After the tissue has been reshaped, the flap is replaced in its original position. In the opinion of those surgeons who perform LASIK, the procedure offers several advantages over the surface treatment of PRK. Because the excimer treats only the inner tissue of the cornea, there's less area to heal, less risk of scarring, less risk of corneal haze, less postoperative pain, less postoperative medication, and vision often returns very rapidly. It can also be used to treat patients with low to very high levels of nearsightedness. However, because of the microkeratome, LASIK results are more dependent on surgical experience than PRK. LASIK is quickly becoming the procedure of choice for many refractive surgeons around the world. However, LASIK is considered an off-label use for several FDA-approved excimer lasers in the United States. This allows physicians to practice medicine in a manner they feel is most beneficial to their patients. Among people who are considered good candidates for refractive surgery, the results today are considerably better than results of even the late 1980s. One reason for these improved results is the highly improved instrumentation and surgical techniques available today. Ultrasound devices now measure the thickness of the cornea with precision that would have been unimaginable only a few years ago. And the computer-controlled accuracy of the excimer laser allows tissue to be removed in thicknesses less than that of a human hair. In planning each new patient's procedure, refractive surgeons today also use case studies from thousands of patients who have already had refractive surgery. The goal of refractive surgery is to reduce your dependence on corrective lenses so that you can enjoy more natural, unaided vision for many of your activities. However, it's important to know that refractive surgery does not always create 20/20 or even 20/40 vision. And refractive surgery does not correct the condition known as presbyopia, or aging of the eye, which occurs to most people around age 40, and may require them to wear reading glasses for close-up work. In fact, people over 40 who have their myopia reduced may find that they need reading glasses after the procedure.
Well, I had refractive surgery on my eyes 13 years ago. I was 33 then, and it pretty much eliminated my need for glasses 95% of the time. Around age 40, I began to need to wear some very thin glasses to help me to read and for night driving. But today, when I'm outdoors, when I'm fishing, when I'm skiing, I can see as good as anybody without any correction at all. So I would say after all these years, I am completely satisfied with my results.
Many studies show that the vast majority of those who are considered to be good candidates for refractive surgery achieve postoperative results of 20/40 vision or better. That's good enough to drive a car without having to wear glasses or contact lenses. Here's how the typical procedure works. First, your eyes are thoroughly examined for general health, and measurements are taken that will help determine whether you would be a good candidate for refractive surgery. Some of these measurements will be generated by an extraordinary piece of equipment called a corneal analysis system. This device gives your doctor a color-coded topographic map detailing the shape and overall condition of your corneas. You'll also be given information that will explain the potential risks and side effects of the refractive surgery chosen to be the best for your specific amount of refractive error, and all of your questions will be answered. Surgical fees and payment policies will also be addressed. On the day of your surgery, you'll arrive about an hour before your scheduled procedure. You'll remain awake and should be quite comfortable through the use of very effective anesthetic eye drops. You may be in the operating room anywhere from a few minutes to half an hour, depending on which procedure you have and if just one eye or both eyes are treated at the time of surgery. After the procedure, you'll be given medicated eye drops and a prescription for a mild pain reliever to reduce any discomfort you experience when you go home. What a patient sees immediately after surgery varies quite a bit from one person to another and from one procedure to another. Some patients see a dramatic improvement within the first day. For others, vision may be blurry for several weeks. Patients can usually return to their normal activities within 1 to 3 days. If you are nearsighted, farsighted, or have astigmatism, refractive surgery just may be your answer. If you feel that your glasses or contact lenses are keeping you from enjoying life to the fullest, let's begin by determining whether you are indeed a good candidate for refractive surgery.
I know I sound like a commercial talking about it, but I have been so happy with the results of the surgery. The results were better than I ever expected. I never thought I would have 20/20 vision out of it. And the healing time was quick. Everything about it was simple. And I can't help but want to promote it to people because I want other people to experience it.
My only regret from having the surgery was that I did not have it done sooner. Knowing that it's been around for nearly 20 years, people have asked me, well, why didn't you have it done sooner? And I guess it's just that I'd never really thought about it until in the last year. And as I got to questioning people who had the procedure, I said, well, you know, this might be for me. And now that I've had it done, I wish I'd have done it 5 years ago.
I would like to tell people who are considering having this surgery to consider how much they spend on contact lenses, contact lens solution, glasses, frames, and everything else. It is well worth the cost. I would do it again, and if I had another eye in the middle of my head, I would do it again.
Refractive surgery just might help you live the life you've always wanted to live.